Good morning. It is estimated that more than 228,000 people will be diagnosed with lung cancer this year, according to the American Cancer Society. Now there's new hope for people battling a particular aggressive type of lung cancer, extensive stage small cell lung cancer. Here to talk about the latest advances in care for people with lung cancer are Dr. Leora Horn from Vanderbilt University Medical Center and Katie Brown, VP Support and Survivorship Programs from Lungevity. Doctor, can you tell us more about the major types of lung cancer?
So there are two main types of lung cancer. There's small cell lung cancer and there's non-small cell lung cancer. And the non-small cell lung cancer will be further divided by histology and also by molecular alterations in the tumor that we see that can help us sometimes select therapies.
Doctor, can you tell us about the signs and symptoms of small lung cancer and the risk factors?
So every patient's different. We know that lung cancer can occur both in smokers and never smokers, but small cell lung cancer really is a disease that is associated with smoking. So tobacco cessation is really important, so smoking cessation. And also if you are a smoker, talking to your primary care doctor about whether or not you should get a CT scan so that we can catch the cancer earlier. Now for small cell lung cancer and both non-small cell lung cancer, the signs and symptoms will really depend on where the tumor is. So patients with tumors in the lung may have shortness of breath or chest pain or cough. And then if it's spread to other organs, those symptoms may depend on the organ that it's spread to.
Doctor, what is the latest progress for treatments?
So we've seen a lot of progress in the last few years for patients with small cell lung cancer. We've seen a lot also for non-small cell lung cancer. But for small cell lung cancer, we're working with Genentech to raise awareness about a new treatment option with carboplatin, etoposide, and atezolizumab, the first two being chemotherapy and the last one being an immunotherapy drug for patients with small cell lung cancer. Now, every patient's different, so they may not all qualify for treatment with immunotherapy, and they really need to talk to their doctor to see if this is a treatment option for them. And we know that these drugs can also have side effects. They can affect the lungs, the GI tracts, your endocrine tract. So figuring out what the right treatment option for you when you've got advanced stage disease is very important.
Thank you. Katie, what should a person do if they or a loved one think they might have lung cancer or are diagnosed with the disease?
A person who's newly diagnosed with lung cancer can connect with a patient navigator or an oncology social worker. They can also connect with advocacy groups to learn about the disease and get questions and answers about types of treatments that may be available for them.
Katie, where can people who are diagnosed with this disease find support?
I would definitely suggest going to our website, www.lungevity.org. You can go to the Lung Cancer 101 section of the website, a Survivor Resource Center, Caregiver Resource Center. You can see videos and just really connect with the lung cancer community so that you're not isolated and alone.
Katie, is there anything else you'd like to add about lung cancer?
I would just like to say that lung cancer is a disease for people who breathe. Anyone who breathes can get lung cancer, and you're not alone. Reach out to your healthcare facility, your navigator, your nurse, your doctor, advocacy organizations. Get connected and find someone that you can talk to.
Thank you. Doctor, is there anything you'd like to add about small cell lung cancer?
So, as I said, smoking cessation is an important part of preventing lung cancer. You should also have your home tested for radon, as we know it's the #1 cause of lung cancer in never smokers. And talking to your doctor about CT screening is an important way to potentially catch this disease earlier.
I'd like to thank you both for taking the time this morning to talk with us. Have a good day.
Thank you.